If a surgeon told you a knee replacement is your only option, pause. You deserve more than 10 rushed minutes and a quick signature. Before you say yes to surgery, ask these questions. I'm Jess. I've been a licensed massage therapist since 2008, a licensed acupuncturist since 2014 with an extensive background in sports medicine and nutrition, and I worked years directly in the OR with orthopedic surgeons as a medical sales rep, guiding total joint surgeries, including hundreds of knee replacements. I have seen firsthand what patients are not being told before and after their surgeries, and I'm here to fill in the gaps. So whether you've already had a knee replacement or you're trying to avoid one, this series is for you. Let's dive in. Start here. What's causing my knee pain? Have we addressed diet, posture, gait, and strength? Have I exhausted every non-surgical treatment first? How much of my pain is coming from inflammation versus actual structural breakdown? How long can I safely wait before deciding? And if you get pushback, eye rolls, or condescension, red flag. The age of doctors acting like gods is over. You're hiring a surgeon, not bowing to one. If they get offended by your questions, it's time to find a new one. This is your body, your choice, your future. Remember, most arthritis doesn't happen overnight. Bone on bone isn't something that pops up in 6 months. It's years, sometimes decades, in the making. So take your time, reflect, ask hard questions. Sometimes the real solution isn't in the OR. It's in your daily choices. Let's get blunt. If you haven't changed your diet yet, you haven't tried everything. And if you're still eating dairy, it's time to let it go. Dairy is a huge driver of joint inflammation. It's the first thing I tell my arthritis patients to cut. Also, if the treatment plan goes NSAIDs, gabapentin, cortisol injections, surgery, that's not a healing plan. That's symptom suppression. Cortisone kills the nerves. It doesn't fix the cause. And when those nerves grow back in a scrambled pattern, that's why the second shot doesn't work. If you want lasting relief, you've got to retrain the body, not silence it. I always recommend gait retraining, postural therapy, and structural integration like rolfing. Here's the catch. It only works if you work. This isn't passive. This is a choice you make every day to take ownership of your health. Your surgeon might know knees, but you know your body, your limits, and your potential. So before you say yes, ask the right questions and make sure the answers serve you. Thanks for watching. I hope you found this information valuable. If you did, hit that like and subscribe button. And if you want to go a little bit deeper, head over to my website. I'll leave the link down below. There you'll have full access to my blog series, courses, health coaching, and many more tools to help you feel better, move better, and just take your health back into your own hands. So remember, keep moving, eat something green, and question anything that sounds like a quick fix. Ciao, ciao.